Well, we're back with Dr. Michaels here. Dr. Michaels, I have a specific question about missing teeth. Now, again, as patients, many of us, we have a missing tooth or two or three, and usually in the back, because whenever we have something like that in the front, we do run to a dentist rather fast because it does look ugly. But in the back, not so much. So here we are for years sometimes, have those teeth missing, and it apparently nothing really bad is happening. It doesn't look all that devastating. And yet dentists like you keep telling us that we got to replace those missing teeth. Can you shed some light on what is that discrepancy? Why do we not really feel any negative effects all that much, and yet you dentists put such a huge importance on it? Can you fill the gap for us there, literally?
Well, if someone has one or two missing teeth, they don't necessarily have to have it replaced. Very frequently, you can go for the rest of your life with a missing tooth or two with absolutely no problems. Okay. And I wouldn't say that you have to have it replaced. I know of hundreds of patients who have a missing tooth or two, and they function very well, and they haven't experienced any ill effects from a missing tooth or two at all. Now, there are times when having many missing teeth can cause great problems, and in that particular situation, you want to make the patient aware of that fact and why. But simply because you have a missing tooth doesn't necessarily mean that you must have it replaced. So perhaps I disagree with someone just on that point. Right. But I can tell you for a fact that I've seen hundreds of patients, many hundreds of patients with who have gone for many decades with a single missing tooth here or there, and have had absolutely no ill effects from that whatsoever. So if you have a missing tooth, don't feel as if you must have that replaced. What would be a good idea would be to talk to a dentist, someone you know and trust, who can answer that question for you honestly and correctly as to whether it's important or necessary to have it replaced. And if it is so, then ask why, because there are reasons for that.
Okay, let's go into those reasons a little bit here. So let's just say let's just say that guy has or the girl has a couple missing teeth, and you right, not the dental association, but you feel like this needs to tell us some of the reasons of the things which could happen. What bad could happen if it needs to be replaced, it doesn't get replaced? What are some of the effects?
If you have some missing teeth and it should be replaced, some of the reasons that could exist that would be responsible for that necessity would be a loss of function. You just can't chew your food properly anymore. In certain areas, it can cause parts of your face to sink in, which can create an unattractive or undesirable appearance. The opposing teeth or adjacent teeth can drift. Those would probably be the only real reasons that someone might want to have those teeth replaced.
Well, I mean, you mentioned the only reason, and that's, for instance, a face being a little bit distorted or caved in and looking like a dried out tomato. Well, I mean, that's pretty severe because in the end, it doesn't matter whether we are young girls or old guys like maybe you and me. We don't like to look older than we are. I mean, it has nothing to do with being super vain, which is so if that does that, then that's a good reason. And so when you say the other teeth can shift, could it possibly be that, let's just say somewhere in the middle back there a tooth is missing, it starts shifting, that it slowly but surely can affect teeth in front, and then your front teeth start not looking so good? Could it be that severe or not really?
Not really, no. If a back tooth is missing, the front teeth are unaffected. The only teeth that drift as a function of a missing tooth would be the teeth behind the missing teeth or the teeth opposing the missing teeth. In addition to that, this drifting phenomena that occurs is extremely slow. It occurs, if it's going to occur, over many years. So in most cases, the necessity or urgency to replace the missing tooth actually doesn't exist.
Okay. Now, I have heard from some, other doctors that because of that missing teeth and that little bit of shifting which you say is going on, might be going on, that what you doctors call the bite, basically the alignment of the upper and the lower jaw, maybe the hinges here, also called TMJ. I cannot pronounce the big word; it's too difficult for me. I just call them hinges, being a mechanical engineer. That they kind of could shift, and that it could possibly cause tension in the neck, in the lower shoulders, and maybe even give headache. Is there some truth to that?
There's one scenario where missing teeth can cause a tremendous problem for people. There's some people who have lost most or all of their There's some people that have lost most or all of their back teeth. If you can imagine, all of your back teeth are gone. All of the pressure is transferred to your front teeth. And the front teeth aren't designed to experience a lot of biting pressure. It's the back teeth that are designed to carry all of that load. So if someone's missing all or most of their back teeth and all the pressure is distributed on their front teeth, that causes horrible trouble. The front teeth start getting pushed forward, and the bite begins to what we call collapse. Instead of coming together where your teeth normally do, then your jaw gets closer and closer and closer over time, and that causes tremendous TMJ problems. This joint that we have in our jaw is called the TMJ, and then there's also lots of musculature that becomes affected by that also, which, as you said, can result in tension and other problems. So that's the one scenario that can give people tremendous grief. And if that's their case, they should seriously consider having those teeth replaced with something like implants or a partial, or there are many options. That'd be something that they should look into carefully.
Right. So let me ask you, so if a person has, let's just say, a few too many headaches, shoulder and neck tensions, and he has checked out a chiropractor or two and has done a few things, whatever that might be, and it just doesn't seem to go away. And whether he has missing teeth or he doesn't have missing teeth, whether he has one or none or a bunch of missing teeth, would it be wise for him to go to a dentist, who does understand TMJ, who does understand the joint hinges and the misalignment of teeth, to kind of fix it or rule it out as the cause? Would that be a wise action for a patient to do?
Oh, that'd be an excellent idea. Either rule it out or have it fixed. Let me tell you, the scenario that you've described, the stiff neck, stiff jaw, popping, clicking of the jaw, or TMJ problems, in my experience, is caused almost all the time by a phenomena that we call clenching or grinding of the teeth. Every single patient I've ever spoken to in my life who has TMJ problems, it's related to clenching or grinding habits. And if you can manage that situation, their problems go away very, very easily and nicely. And that would be the first thing that you'd want to consider as a possible problem, or a possible cause of the problem.
I got it. And of course that grinding or clenching has little or can definitely occur whether the guy has all teeth in it or not, right?
Now, this clenching can occur whether the person is missing teeth or not. And in fact, missing teeth can be a participating factor, but it's principally not. The major factor is the individual's stress management systems that they have. People are they're under a lot of stress nowadays. We're all very busy, maybe too busy. The economy is making it difficult for everyone. Job security isn't what it once was. Both parents are working if both parents are at home, and there are a lot of opportunities for stress. And for many people, the stress can lead to clenching, and it causes tremendous problems: headaches, stiff jaws, popping, clicking, even toothaches, tooth pain, sensitivity, a variety of things. And that'd be something that someone would want to look at, I think, shortly thereafter seeing their physician.
Yeah, we're gonna kind of like have to end this here, but I appreciate your very candid information about the missing teeth. It's probably very good news for many people who perhaps have been told that you gotta replace every missing tooth there is, and that's kind of, it looks to me like that sometimes is more like a choice rather than a necessity. Maybe a good choice, but not necessarily a necessity. And I think that's good. People, as you mentioned, economy and everything isn't so good, so it's one one bad thing off their plate to say, look, I can actually sleep with them. It's not going to kill me. And if things get better again, I can always replace it. But in the meantime, it isn't going to kill me. Thank you very much, Dr. Michael, for being so candid and informative. Bye-bye.
Thank you, Helmut.